Hello, everybody. I'm Dr. Cain. I help people with peripheral neuropathy get out of pain and back to doing the things that they love doing. One of the ways that I help you do this is by connecting you with the right people, products, and services that can all help you get better. So today we are very lucky to be joined by Dr. Jody Stanislaw. She's a doctor of naturopathic medicine, has been so since 2007. She's a certified diabetes educator, type 1 diabetes specialist. And for those of you that have neuropathy, you've probably heard by now that diabetes is by far the most common cause of neuropathy. So if you have type 1 diabetes, you definitely need to listen to this interview. She's had it since she was 7 years old and dedicated her life and her career to helping other people that have it. She's been doing this for 30 years, both in person and with her virtual programs for people across the world. So she's a wealth of knowledge. She teaches life-changing information that people with type 1 diabetes desperately need to know, and most of them are not getting from their physician. So thank you very much for joining us today, Dr. Jody.
Thanks so much, Dr. Crane. It's an honor to be here.
Yeah. So let's jump right into it. The first question that I have is, what's the difference between type 1 diabetes and type 2 diabetes?
You know, it is very confusing in the masses. It seems very few people can really clarify that, but I will be able to clarify that for you, hopefully, in a minute. Type 1 is an autoimmune condition. Autoimmunity is when the immune system attacks parts of the body, and in type 1, the immune system attacks the cells that make insulin, which are located in the pancreas. And I was a very healthy and vibrant 7-year-old one day, and the next day I got tired and thirsty and cranky, and I literally was so dehydrated. I cried, my mouth was dry, my eyes were dry. And after 7 days or so of this going on, I was taken to the doctor. I peed in a cup and my urine was absolutely full of sugar, and I've been on daily insulin injections ever since. There's no known cure for type 1. It doesn't matter if I eat less. It doesn't matter if I exercise more. They haven't figured out a way to grow back my insulin producing cells yet. They literally were attacked. Like, the attack likely started months or years before I actually was diagnosed. They say that you have about 20% of your insulin producing cells left at the time of diagnosis, and then they eventually die off within the next few months or years. And so I have to manage my blood sugar level on a daily basis. I have a little continuous glucose monitor that I keep with me at all times. I have a pretty stellar reading today, 83, nice. Flat line. That's very good. That's good news. And so this is a constant work. It's every day I'm monitoring my blood sugar level. There's no second nature, it's just automatic pilot, because every day I eat differently, every day I exercise differently, stress hormones, if I get sick, what my cycle's doing, if I'm traveling, if I'm sedentary, if I'm active. So managing blood sugar levels on a daily basis takes a lot of work. So type 1 is very labor intensive. Type 2 is more of a wear and tear on the system. People don't feel great one day and feel sick the next. It's a very slow onset. It can be over years or decades, where they're insulin producing cells, and the cells that have to actually respond to insulin, they just get sick and tired of responding to insulin, and the cells get tired of making insulin. So if insulin is a pickup truck for sugar. So you eat sugar goes into the bloodstream. Insulin is what picks up the sugar out of the blood and feeds it to the cells. So the reason why I got horrifically dehydrated is all my sugar was staying in my blood. There was no pickup truck to get the sugar out. So the kidneys had to work overtime, and that's why I had sugar in my urine. I was peeing out all that glucose, and my body was taking every little bit of fluid it could to clean it out. That's why I was massively dehydrated. But type 2 it's just like a really slow, over time, you make a little bit of less insulin. Less insulin means a little bit higher blood sugar level, and then a little higher blood sugar level the next year, a little higher the next year, and a little higher the next year. The system is just getting worn out. It's getting overworked. The cells are getting too weak to keep up. And type 2 most type 2s can reverse it, because I don't even like to really call it a disease. I don't know if people are upset with me if I say that, but it's a worn out system. It's not something that hits you overnight. it's a worn out system. And if you stop wearing out the system, if you exercise more, if you eat better, if you lose weight, if you get the system healthier, then the blood sugar level normalizes and you, quote, cure yourself of type 2. So but high blood sugar level is what we have in common. If I don't give myself insulin, if they don't eat healthier and take care of their body, blood sugar level rises. And that's when they're going to eventually come and see you.
That's right. All right. So I see how the prognosis is a bit different. Someone that has type 1, they're probably going to be that way for the rest of their life. And then type 2, it's much more reversible. They can essentially kind of get out of that condition if they really adopt the right lifestyle habits. In terms of what people can do to make the best of their conditions, what would be the difference in how a type 1 would manage their condition versus a person with type 2 diabetes?
Well, there actually is a lot of similarities. Healthy diet and exercise are absolutely key. They're the most important medicines, not only for people with diabetes, but for everybody. And I encourage my patients to eat real food, which means food that grows from nature, not that's made in a plant. And I encourage patients to mostly choose low carb. The less carbs we eat, the easier it is to manage our blood sugar level. I mean, it's just that easy. If I'm going to have, a piece of fish and some veggies, that's a lot easier to figure out how much insulin I need than if I'm going to have pasta and bread with a glass of orange juice. That would be a nightmare. So, if we eat, don't have, Cheerios for breakfast, have, a chia seed pudding for breakfast, or eggs and one piece of toast, or, don't have 2 pieces of bread and French fries for lunch, have open face sandwich and some veggies or something. So, and the type 2 needs to eat less sugar to give their system a break. And the type 1 needs to eat less sugar just to make their blood sugar management job easier. And then, of course, exercise makes you more efficient and healthy overall. And it's very important for both kinds. So the only difference is type 2 is often managed with oral drugs for many years until the oral drugs don't work. And then they start taking insulin. And eventually they could literally have zero insulin production. They could literally kill out their whole insulin production system. That's very late stage type 2 though. Most type 2s still make insulin, but type 1s are on insulin from day one.
Okay. So type 1, so both of them are going to eat a healthy diet and exercise. And for type 1, anything in addition besides the proper diet and exercise and properly using their insulin that they would do to best manage their condition?
Well, when patients work with me, if they're newly diagnosed, there are ways to actually preserve beta cell function for an unknown period of time, but I have seen my patients being able to preserve beta cells, which makes blood sugar management easier. But the reality is we have a higher risk of neuropathy. We have a higher risk of brain damage and heart disease, kidney failure, strokes, blindness. And so not only keeping your blood sugar levels in the normal range is ideal, but there's actually I have a comprehensive diabetes support supplement that I recommend. It's called Diamend. It's made by Priority One. And there's 2 major benefits of it. And it it helps reduce glycation, the damage that glycation causes. And it also helps patients to be more insulin sensitive. So their insulin works more effectively so they can take less. And because I'm a naturopathic doctor, I also help patients with the whole picture of their life. What supplements are they on? Are their bowels in their gut health good? Is your emotional health good? Emotional health is really important to touch base with when anybody with a chronic disease or chronic pain condition. I mean, we're not just these physical bodies, we also are emotional, and we need to really address that. So I work with patients virtually all over the world. I have phone consultations that I do with patients, and I become the counselor. I become a counselor. I love doing counseling for my patients. I also become a bit of a life coach. I help them get going with their exercise and, taking their lunch to work or whatever it is. So I have patients in 10 countries and all across the US, and I do an annual retreat in Idaho. So I have a very unique practice. I work virtually and I don't even see patients. I'm just in an office right now, but I don't actually see patients in person because my patients are all over the world.
Okay, cool. And I was real happy to hear when I got to know you, it was several months ago, that your approach is a very practical approach, and that health coaching, that life coaching essence, I feel like is something that is just this world of diabetes, or anyone who's trying to make improvements in their health, that they really need. And just as how you talk about diet and how you make it, practical and something that people can actually do and sustainable, because there's so many other people out there that say it's got to be this hardcore ketogenic diet, or just eat lettuce for the rest of your life and nothing else, eat like a bunny. And it's just, that's not really feasible. And people need to enjoy the food, need to enjoy the process. So I really, really like and respect, and just think that the world needs more of that kind of mindset embedded in how they go about making their improvements. So
yeah,
let's do that. So if someone were to say someone has type 1 diabetes and they were to take you on as their coach, or get guidance from you, or one of your virtual programs, if they were to follow through with all the recommendations, what type of improvements would they expect?
Dramatically better A1Cs, which of course correlate to better blood sugar levels on a daily basis, which of course correlates to feeling happier and having more energy. Because when your blood sugar levels are going like this, your moods, your energy levels go like this, and your appetite goes like this. So your whole system functions better when your blood sugar levels are better. Not to mention, if I'm helping you with emotional health and exercise and diet, I mean, that helps anybody feel better. So the ultimate goal that we all want is to feel happy and healthy. And that is my ultimate goal for all of my patients.
Yeah, absolutely. And from my end, the neuropathy too, just having way too high blood sugar is extremely toxic to the nervous system. It just causes so much damage to the blood vessels and the nerves. So that's can very much be a good thing for that aspect as well. So what would you say are the most common challenges that people with type 1 diabetes have in terms of making improvements?
That's a great question. Well, the reason why I've dedicated my career to helping type 1s all over the world is because every patient that comes to me, literally from any country, explains to me how they feel like they can't find a physician that really truly understands how complex their life is, how complex it is to really manage type 1. And it's true. There's very few physicians that really grasp how complicated managing type 1 is. So it's not just what you eat. I mean, I can be super stressed out, my blood sugar level goes up. I can gain a few pounds, my blood sugar level goes up. I can go on a car trip or an airplane ride that's a couple hours, my sugar level goes up. And we're never taught all these fine tuning things. So I have type 1, which is really the best school to understand type 1. I've had it since I was 7. So number one, really truly getting the actual thorough education that they need, which is it's just rare to find really good education. And number two, the support, the emotional support. I have group support programs. I have group calls. I do, a lot of us with type 1 don't know anybody else with type 1. We're out here doing all this work by ourselves, and, our loved ones can say, oh, you're doing such a great job, but they don't get it. So yeah. I provide community support and thorough education. And I'm so passionate about getting my education out that I've actually made several online courses: how to master your blood sugar level with exercise, how to get off the blood sugar roller coaster, what to eat, how to dose, how to avoid emotional burnout. And these are all on my website, which is Dr. Jody ND. And that's DRJODYN as in naturopathic, D as in doctor. And I have a membership course there where you get all the courses, plus be part of our group calls. You can also sign up for a private free call with me to learn about working with me. But, what I provide, I really don't know anybody in the world that offers what I do. Virtual type 1 diabetes specialty training from a type 1 physician. I don't know anybody else that does what I do.
Yeah, I don't know either. So it's a great resource you provide. And we will have links for all of that in the description for the video too, so people can get an easy click to it. So
great.
Well, fantastic, Dr. Jody. Anything else you'd like to leave the viewers with?
For any of you that might not have type 1, if you know somebody with type 1, please direct them to my website. A lot of patients with type 1 have lived with it for so many years, they feel like they know everything and they feel like there's nobody that can help them. But I guarantee you, I feel like I've helped everybody that has met me, and it's my joy to help type 1s, whether they know they need help or not. So if you know anybody with type 1, please just show them my website, see if they're interested. And thank you for sharing my name with anybody who's listening that knows somebody with type 1. Yeah,
fantastic. So there you have it. If you have type 1 diabetes, definitely check her out. Check out the links in the description. And she's I couldn't recommend anyone higher for support with type 1 diabetes. So thank you very much for joining us on the interview, Dr. Jody, and thanks to all our viewers for watching. And if you do have neuropathy, stay relentless, continue to educate yourself, and in time, you can have yourself in a much better place. So thank you very much, everyone. Have a great day.
Bye.